Hello, wherever you are in this beautiful world. Dr. Mark DiPasquale here from Adjusted Chiropractic, just going through some latest research and some new research article that was just published this month with press release as well. Chiropractic helps suffering boy. I'll take you through it. Let me just take you to the article now. If you like reading articles like we do, you just need to sift through the pages and pages, and I like printing them out and underlining them as well and keeping in reference folders too. But yeah, this is a young boy, 13 years old. Now, this was published in the Journal of Pediatric Maternal and Family Health. Lower back pain, a couple of other health issues which we were looking at, or that they were looking at in this case. I'll take you through the press release because I think that's the most exciting thing. Here we see it was actually published on October the 4th. And if we go straight to the press release here, it states in this press release. Now, press releases, this is what newspapers get, TV stations get, etc. If they want to run these stories for their viewers and their listeners and their readers. Numerous case studies and some clinical studies are revealing that there is a relationship between abnormalities in the spine, the nervous system, and the various health challenges that people experience. That's how it's framed. In the case report presented, the young man was suffering from low back pain and May-Turner and superior mesenteric artery syndrome that improved under chiropractic care because of the nature of the nervous system and its relationship to the spine and pelvis. So look, I'll take you through a few key points in this press release and this article here as well. According to researchers, the nervous system controls and coordinates all functions of the body, and structural shifts in the spine and pelvis can occur that obstructs the nerves and blood supply and interfere with their function. By removing the structural shifts, chiropractic improves nerve supply and function. This really does remind me of myself when I was younger, not 13 years old like this boy, but 17. Back then when I was 17 years old playing football, I had an injury, a lower back injury, which I couldn't play football anymore, and weeks and weeks and weeks sitting on the sideline in a lot of pain. I went to my doctor, I took painkillers, all sorts of things, my club physiotherapist, massage therapist, etc. They really couldn't get me back up and running. In the end, it was a friend of mine who said, and basically dragged me into their chiropractor's office, and I got back on track after that. So, and the fundamentals of that was, if we go to this case here, so the 13-year-old male reported on in the study had lower back pain, which started while playing baseball. The pain was so severe that he had to sit out for the rest of the game. The pain was worse with bending, twisting, lifting, and overall movement. Pain interfered with his ability to play sports as running, twisting, bending were difficult. He was diagnosed with May-Turner and superior mesenteric artery syndrome. Home care and over-the-counter medications did not help him, and pain interfered with his ability to play sports. Running, twisting, bending were difficult. Now, just going through, he had this pain for over 2 months. He categorized it as an 8 out of 10. A CT scan was ordered by his medical doctor. It showed us L4 bulging. Okay, this placed under the L4 vertebra and bulging of the disc at that level. Self-care at home, he used heat, essential oils, ibuprofen, which is a non-steroidal anti-inflammatory drug. All didn't work. And the outcome, as we go through back into the article, if we go to the outcomes here, adjustments were used as a combination of chiropractic techniques were used, and by his 10th and 11th visits, the patient experienced relief of pain symptoms with only mild intermittent low back tightness and activity, which I'm sure would have continued to resolve as he continued on to sort of maintaining the improvements and further healing and getting further spinal stabilization. So quite an extraordinary case for this young boy, and the question begs for me, just like when I was 17, what if chiropractic hadn't have changed my life? What if chiropractic hadn't have changed this boy's life? Where would he be? Well, he'd be in a much worse place. well, he wouldn't be in as good a place as he is now, that's for sure. And likewise with myself. It made such a difference for me, I decided to study chiropractic and be a chiropractor myself. So that's how profound these types of help and improvements can actually make. So there's a, there you go, there's a case review of some latest research about this young boy. Good on him, good on to chiropractic care. Obviously, if you have any questions with regards to anyone in your family, friends, your own care, someone else's health, etc., please contact me. I'm always here to help by email, by phone. You can contact any of our team as well. We're all here to help you too. In the end, you need to look after your health because no one else will. Bye for now. Look after yourself.